good news arrives just before Valentine's Day. Chocolate is good for diabetes, but it depends on the type of chocolate. The difference between dark and milk chocolate is more than the added milk. Dark chocolate contains more cacao and less sugar than milk chocolate. Cacao is the raw, unprocessed form of cocoa. The British Medical Journal's research indicated that participants who consumed about 5 ounces of dark chocolate weekly had a lower risk of type 2 diabetes than those who rarely ate chocolate. However, the American Diabetes Association (ADA) warns it is important to note that studies like these highlight overall patterns. For example, those who eat dark chocolate may also have other healthy lifestyle choices, like an eating plan or activity level that lowers their risk of developing diabetes. It does not mean you should start eating dark chocolate to reduce your risk of diabetes. Another research studied 433 diabetic patients to see how eating cocoa or chocolate affected their cholesterol, blood sugar, and blood pressure. The study published in PubMed found that eating cocoa or dark chocolate lowered fasting blood sugar and LDL cholesterol. Also, the Modern Sport Journal features a study examining the effects of 85% dark chocolate. After 45 days, subjects showed improved fasting glucose, lower cortisol, and higher serotonin and potassium levels. There are also other benefits to eating dark chocolate. Dark chocolate's flavonoids are potentially good for the heart because they improve blood vessel flow. Flavonoids are also antioxidants that protect cells from free radical damage. You've heard that eating chocolate triggers chemical reactions in the brain that mimic the feelings of falling in love. This is because of its phenethylamine, PEA content, which triggers endorphins and serotonin, boosting mood. Even Cupid needs a little help sometimes. Adding more dark chocolate to your diet might be beneficial. However, remember that a higher cacao content means a higher fat content. Also, limit added ingredients like caramel and toffee, which contain sugar. Choose chocolate with 70% or more cocoa. Drink unsweetened cocoa powder, which is 100% cacao. Add cacao nibs to yogurt, fruit, smoothies, and pancake batter. While the research does not imply that eating dark chocolate will prevent diabetes, its polyphenols could reduce fasting blood sugar and decrease insulin resistance. There are also benefits to the heart, just in time for Valentine's Day. Please remember this is not medical advice or intended to replace the advice of your doctor. Always check with your healthcare provider before trying new treatments. Please keep an open mind, be a diabetic detective, and do your own research. Work with your healthcare team, see what works best for you, and monitor your blood sugars. Follow here and at backtonatureddiabetic.com for more tips and information.